Hi everyone, Karen here, your dental hygienist from 416 Dentistry Studio here in Toronto, Canada. Our office is a GBT Certified Dental Practice where we have integrated this comprehensive protocol from Switzerland. It has been a game changer and we've received incredible feedback from our patients. So much so that we have decided to invest in a second Prophylaxis Master. This time around for this unboxing, I will reveal what's inside and at the same time go over my experience using this amazing equipment. The EMS Airflow Prophylaxis Master comes in this box. When we open it up, you can see what's inside. As you can see, everything is carefully packaged. This is the instructions for use. Make sure you read through this thoroughly for best performance and maintenance of your unit. Next, we have the power cord for the unit itself, as well as the air and water cords for the unit. Here we have two of the bottles. One is for water and one is for disinfection of your unit. They are color coded so we don't mix it up, and make sure you follow the manufacturer's instructions for use. Next, we have the foot pedal. It is completely wireless, and oftentimes with wireless technology, we often worry about lag or connection issues, and we haven't experienced any of that. Another cool feature of this pedal as well, on the center of the button, there is a boost feature, which helps increase the intensity. This was really well thought out, and it makes it so that you don't have to fiddle with the machine, change the settings while you're treating a patient. This is great for efficiency and infection control. The Prophylaxis Master has two main components, one of them being the Airflow and the second being the Piezon. This is the Piezon handle. It also comes with a PS tip included inside. The unique thing about this handle is that it comes with an LED light, which helps with visualization. The PS tip itself is very unique and it has a really thin design that treats about 90% of all cases. We'll go over this in more detail in a future video. It is very technique sensitive, and in order for clinicians to practice adaptation and comfort for the patient, these are some training sticks for us to refine our skills. All right, next we have the Plus Powder. The Plus Powder is a erythritol powder. The powder is a derivative of xylitol. It's extremely fine at 14 microns and is tissue friendly. Since it's so fine, there isn't any discomfort or prickly sensation when it comes in contact with the tissues. It's safe to use on restorations, implants, veneers, and crowns, and it can be used both above and below the gum line. And we get another box. And another box. Alright, next we have the Airflow Classic Powder. This is a sodium bicarbonate based powder, really good for removing very tenacious stains. However, you want to make sure you stay away from the tissues with this powder. And we get two bottles of it. Alright, next we have the Airflow handle. This particular handle is what is used to disperse the Classic and Plus powders. Next, we have the PerioFlow handle. This comes with two unique tips. One of the tips being the Perio one, which is a plastic component which goes subgingivally into the gums to treat patients with gum disease or deeper pockets up to 10 millimeters, and it disperses the air, water, and powder in 3 different directions. Another component to this is the implant tip, which is great to use around implants, crowns, and deciduous teeth. All right, next. All right, next we have the powder chambers. This one is for the Classic powder, and this one is for the Plus powder. They are color coded so that we don't mix the two powders up, and they are easily interchangeable when the patient is in the chair. And last but not least, this is the EMS Prophylaxis Airflow Master in all of its glory. It is pretty heavy. I'm going to move the box onto the floor first. And move it up. As you can see, this is a beautifully designed piece of equipment, and I honestly can't imagine practicing without it now. If anyone has any questions about GBT or the Airflow, please comment below and I'd be happy to share my experience with you. I'm truly proud to be part of the GBT global movement. Thank you to our friends at EMS Switzerland and Oral Science Canada for all of your support. Thanks for watching, and stay tuned for more content regarding GBT and the Airflow. We have some really exciting things coming down the pipeline, so stay tuned. See you soon.